the Shenandoah Chamber and Industry coffee showcasing the Phase I of the emergency room remodeling and expansion. And you know, this is just another chapter in the incredible transformation that's taking place at the Shenandoah Medical Center. You know, just about 2 months to the day that we met in December for the grand opening of the $20 million Shenandoah Medical Office building and entrance. And I know there are other projects in the wings that Karen's going to discuss a little bit. And I'd also like to take this opportunity to thank Karen Cole, CEO and President of the Shenandoah Medical Center, and all the board members of the Shenandoah Medical Center for not only having, you know, the vision to make this a first-class medical facility, world-class medical facility, but also having the courage to implement that. You know, that's not always easy. It's always easy to have vision. It's extremely difficult to implement that. A lot of criticism goes with it, along with all the great things that end up being what this center is. So at this time, I'm going to introduce Karen Cole, CEO and President.
Thanks so much, everybody, for coming out again. As Greg said, you were just here a couple months ago, so I appreciate the fact that you were willing to come back out again and spend some time with us. I hope you've had a chance to tour a little bit of the first half of the emergency department. If you haven't, make sure you get all around. And there are various staff members around, so if you have some questions, they can help you out and try to answer your questions for you. It is really exciting for us. This is a need that was just incredible. We could see the need. We've grown our emergency department, we grew our volumes, we grew our staff, and our staff and our patients have been very inconvenienced, especially this last year. And I just want to thank our patients, the community here, for putting up with us this last year, and mostly the staff also, who have had to live through this. It's been very trying sometimes, and they're so excited to get back into this new area now. But as Greg told you, this is just the first half of the new department. The wall to my left here, that's a false wall. And in 4 months or so, that'll be the last thing to disappear, because on the other side, where the emergency department is currently in operation, that's the space that's going to be remodeled and will be added to this space. And that space will house 3 trauma beds, another exam room, a staff lounge, supply area, and the rest of this nurses station, so that the nurses can visualize the patients in the trauma room. And it would have been ideal if we could have waited till we could put the whole thing together to invite you out, but it isn't going to work that way, because we're going to be working in here, and we'll be operating and doing all kinds of, we'll be in operations, doing all kinds of things, and we just can't have you then. So we're just thrilled to have you here today. I wanted to talk just a few minutes, just a lot of thank yous, because there are just a lot of people that make something like this happen. And I want to say thank you to the mayor and to the city council members. Thank you for being here today. Thank you so much for all the support that you've given us. I want to thank you, the chamber, for the support that you also provide us. And many things happen during a construction project that you need somebody's help, somebody's hand. And you know, in this community, people are always there for you. And we want to also continue to be a good community member with you, and we just cherish the partnerships that we've had with everyone. So thank you very, very much. I also want to recognize and thank Altus Architects, Graham Construction, Carlson Consulting, Bob Carlson, D. Fisher with the USDA. These are our partners throughout this process. They've done a great job with us. It's not just getting the job done, but it's also how you get it done. And I think these people work with heart. They understand. They construct hospitals and healthcare institutions. They understand what we have to do here. And so they put their heart and soul into it. And then when they're working here, they understand that in the meantime, we're still taking care of patients. And so they are very accommodating. They understand the infection control issues that we might have. They understand they need to get out of the way when we have a patient. You know, it just makes it so much easier when you've got the right partners to work with. So we're very appreciative of the folks we're working with. I want to recognize our board. They don't get enough recognition. Thank you, Greg, for mentioning them, their vision, their support. Alyssa McGinnis is our board chair. For those of you who don't know Alyssa, you can raise your hand. We have our vice chair, Mary Jo Carroll's here today. Where are you, Mary Jo? We have our secretary treasurer, Greg Ritchie, is here today. Tim Augustine has served several years on the board. We appreciate Tim and all of his support. Ed Cloverdance, also a past chair. We have, I don't know if Dave's been able to make it yet, Dave Leisure, but he was going to try to stop in a little bit later. Joel Barrett's out of town, wasn't able to make it, or Roger Jones or Dr. Jones, but these are all of our leaders of our organization, and we can't do it without their help and support. So those are the leaders, thank you, and could you please give them. I'd like to also recognize our medical staff, just in general, because throughout this whole construction project, they've been asked to, move this way, move that way, change here, change there, and they also are very accommodating because they understand the vision. We have a wonderful medical staff here. It's a great secret. Not enough people understand and know. I've worked other places in other hospitals, and many of you have also. And I'm not sure that people understand the gem that we have with our medical staff, because it is a very collaborative relationship. We have some people with some wonderful expertise and specialty services that you don't necessarily find in a community this size. So I just want to give recognition where it's due to our medical staff. Now, I don't do what I do without a whole bunch of people behind me, 350 or so these days. But I do have a senior leadership team that is just outstanding. And I want to keep every single one of those people here as we continue to move forward for Shenandoah Medical Center. Our Chief Financial Officer, Matt Sells, where are you, Matt? Thank you so much for all you do. Our Chief Human Resources Officer, Kelly Royals, behind here. Our Chief Information Officer with the Southern drawl, Chuck Doherty. Everybody knows Chuck. Denny DeWild, come out from hiding there. Denny's in charge and I'm behind. But Denny also has been very instrumental in this project and works closely being the administrative supervisor for our facilities department. So we appreciate everything that Denny's helped to do on this project. I don't know if Tim Gromas, I haven't seen Tim here this morning, our practice administrator. Tim's a part of this team. And two more recent folks that have joined us. Jonathan Moe, our Chief Operations Officer. Where are you, Jonathan? Jonathan comes to us from the north, so you hear kind of a different kind of accent when you talk to Jonathan. But he's been a great addition to our team, and we're just really, really pleased. Jonathan was CEO with a couple of hospitals with the Avera Health System, so the expertise that he brings into this organization is just, it's been terrific. I also want to recognize our new Chief Nursing Officer, been here about 4 months. Laura comes to us from Wichita, Kansas. She worked with Wesley Hospital. For those of you who are familiar with Wichita, pretty good size. She is an experienced Chief Nursing Officer. We are, again, very fortunate to have her expertise here. But her husband's from the Omaha area, and so they're both looking to come closer back to home, and that's how we were fortunate to get her here. I want to talk a little bit about, and probably can't talk enough about the leader of our medical staff for the emergency department and for our hospitalist services. Dr. Santosh Kumar has been with us. He was here when I got here. He was here a year or two before me. And I always say to people, he's a star.